Hello, Matey Thrive Nation. We've got our first dermatologist, board certified dermatologist on the show after 5 years, and there are many reasons for that. But when I did check out this brilliant Dr. Mina and her website, she's got a lovely Instagram site. It's wonderful to have her on the show and to share expertise. So a warm welcome to the Matey Thrive show.
Thank you so much. I'm thrilled to be here and connect with you. I love the work that you're doing.
Brilliant. So just tell us about the state of skin health, because I've just seen over 26 years as a physician, I've just seen people's skin just deteriorate, and there are many reasons for that. But what is happening with overall skin health?
Yeah, well, I think it's overwhelming for people. It gets overwhelming for me as well. So if you are listening and you're thinking, I don't even know where to begin, totally natural feeling. And I notice, at least for me and a lot of my friends, you can kind of fake it to a certain point. I know I wasn't always taking the best care of my skin for a long time, but it does seem that around, I would say 40 or so, that's when you start to notice these bad habits in your skin. You might notice some changes, look in the mirror and think, oh my gosh, and even if you have been taking care of your skin, you start noticing these changes. So I do find that is sort of like a checkpoint for people who are like, wait a minute, I'm not loving what I'm seeing. And, sort of you're at this like crossroads, like what to do next. So really my message for people is that skincare can and should be simple. It doesn't need to be overwhelming. You don't need 1,000 different products. And unfortunately, though, we're like constantly being marketed to and sold. Oh, you got to get this, you got to get that. Like, it's hard to feel like you're missing out. But really, there's just a few basic things for skin health that are must-haves, the foundational pieces.
Cool. Now, I know you probably specialize in, the perimenopausal and menopausal women, and you see a lot of that archetype. But across the board, are you seeing an increase in dermatitis, eczema, psoriasis, skin cancers? Just give us an overall view in terms of what's happening with a very important organ of our body.
Right. So a lot of that, we're seeing a lot of inflammatory skin conditions. We're learning more and more how obesity and metabolic syndrome and our gut health impact our skin health, and vice versa, actually. So we're seeing more inflammatory skin conditions and worsening that tend to improve when our metabolic health improves. So that's why I always say skin health is whole body health. It is not just for aesthetics. It's not just our face. It actually, works and talks with the rest of our body. Definitely seeing a ton of skin cancers, which is really concerning because, and people ask me, well, why are we just diagnosing them early? Are we just treating these little ditzy things that we don't need to be? But the reality is we're living longer, significantly longer than we did even 100 years ago. We're spending more time outdoors, right? And back in the day, it was almost seen as not good to have a tan or to be outside, and now it's sort of flipped. Having a tan is like a sign of, taking nice vacations and luxury and all that. But unfortunately, we're seeing a ton of skin cancer. We're living longer. And so our body has more UV mutations to deal with. So definitely seeing more of that as well.
Brilliant. I'm so glad that you included sort of gut health and, metabolic health, because I think the struggle that I've had with dermatologists, I've got them in the building and some of them are my friends, is just, this approach of looking at the skin topically and not looking, deeper and asking deeper questions. What's happening with your diet? What's happening with your toxic load? What's happening with your stress levels and what that does. I want to go through your skin routine. I know it's the topical part. We will get into things like peptides and diets and, an anti-inflammatory diet. I know the levels of inflammation, just the labs that we've been doing for, 18 years now, the last 5 years, we've never seen levels of inflammation as I have in the last 5 years and before. So, but let's talk about your skin routine. Obviously a beautiful skin. And obviously you pride yourself in that, walking the talk. How does it start? And let's start it at night, because I think probably a very, very important time is a night routine.
Right. Yeah. And nighttime is kind of getting your skin ready to repair, right? When we're sleeping. So very important, for most people who are awake during the day, right? We're not talking about people who work at night, but at night, you really do need to clean your skin. So use a gentle cleanser. It does not have to be fancy. You don't have to have a separate cleanser for your face and your body unless you want to. My go-to is, I've been using it for decades, is just the Dove Beauty Bar. We use it in babies. It's just very gentle, but you do need to clean your skin. You've got oil, sebum production. You've got, our skin is constantly renewing, and so you need to remove dead skin cells. All the pollution from the day, makeup. So you've got to cleanse your skin. Gentle cleanser. Just using your fingertips is fine. You don't need to do any crazy scrubbing, anything like that. And then if you want to be, a minimalist, then I would say put on a moisturizer when your skin is a little bit damp, and you can call it a day. Like, you don't have to do anything more than that. And that is just going to keep your skin hydrated, and it's clean, and it can repair and renew overnight. And that's it. Now, some people, I'm a little extra too. I'm not that basic, right? But there's nothing wrong with that. That's what my mom's been doing, and she's 70 and looks amazing. But I like to use a tretinoin or a retinoid, which is a vitamin A derivative. It's probably the most powerful topical collagen booster that we have. It also helps with cell turnover. As we age and get older, our cells normally turn over about every 21 to 25 days. As we get older, that slows down. So it's important to kind of help our skin along. But I've been doing that for decades, and I really credit that and sunscreen use to my skin, really, because that's what I've mostly been doing. So using a vitamin A cream, whether it's a prescription strength or not, I think can be really powerful. And you can leave it at that. If you want to be a little more extra, I don't think that's correct English, but then you could add things like exosomes or growth factors or peptides as well, if you want to, do something like that. So I would say really nothing more than that. However, that really, you don't need more than that. Now, for my ladies who are 40 plus, I'm also a big fan of estrogen cream that you can use topically. You can either use your vaginal cream from that, maybe your GYN has prescribed, or they make some that are formulated for skin of the face that are a little more elegant, and you can use that as well. So I think of that as being in place of the moisturizer.
Brilliant. Now, are you concerned about parabens and phthalates and any of these toxic chemicals as endocrine disruptors? Just, the research going on how many, toxins have been introduced into our environment, and especially in beauty products and fragrances. What's your view as a dermatologist with regards to these toxins?
Yeah, well, unfortunately, parabens are a type of preservative, and I think people hear preservative and they think, "Oh, that sounds awful. I don't like that." But really, preservatives are there so that mold, bacteria, fungus, microbes don't grow in your skincare products. Because if we did not have preservatives, it would get very moldy, very gross, very quickly. And so that's why we have preservatives. So preservatives are not bad. They extend the shelf life of our products. And parabens have been used very safely for 100 plus years. Some studies that were not well conducted and were not done in humans sort of made a association that they might be associated with endocrine disruptors and things like that. But there have been no solid good studies confirming this. And we do have 100 plus years of parabens being used. Nonetheless, no one is ever going to be able to turn back. Parabens are canceled. They are gone. No skincare company is going to put them out there. Unfortunately, now they're replacing them with other preservatives because, again, we need preservatives in our skincare products. And a lot of these newer preservatives that we're using are a little more they can cause more allergic reactions in people. They're not quite as safe from that perspective as parabens. But it's kind of like public opinion determined parabens were bad, and so you'll never see those again. But I am not worried about skincare products being toxic. At least in the U.S., things are looked at pretty closely. I think there's a lot of fear factors out there. Like there was a whole benzene scare in certain products, and that was quickly turned around. But really, I would say if you're worried about the safety of skincare products, use less. I think that's one thing like we don't talk about enough. If you're worried about clean beauty and the environment and your health, like you don't need to be using everything. Just keep it really simple. And so that would be my advice. But I am not worried about parabens. Fragrances, I would say it's overdone. Honestly, people are putting fragrances in everything. They want their babies to smell like lavender. They want their toilet paper to smell like lavender. I mean, it's too much. Our skin doesn't need to smell like a botanical, and it can cause allergic reactions. So I tend to go with fragrance free as much as I can. If you are very sensitive, have very sensitive skin, then you really need to be careful about fragrances. But in general, I would say let your cologne or your perfume be your fragrance, and let your skincare, your skincare doesn't have to smell like roses.
Brilliant. Maybe you want to unpack exosomes and peptides. That's pretty much the rage. We've been doing peptide therapy a long time, but what about them in sort of the topical products?
Yeah. So I think with peptides, it's still a little bit tricky because they are large molecules. So our skin barrier prevents a lot of bad stuff from getting in, as well as keeping good stuff in. And so peptides tend to be larger molecules. And so in skincare ingredients, it's really hard. Same thing with like hyaluronic acid, right? Like everyone wants to say their product has hyaluronic acid, but is hyaluronic acid, is it really able to penetrate the skin barrier and get down into the dermis, which is where we want it, where we need it? Same kind of deal with peptides. So I've yet to find like really great skincare products containing peptides that I know can get deeper into the dermis where we want it. I do think that all of this is going to be changing like really quickly. Exosomes are one such way that we can transport these messages deeper into the skin, into the dermis. So I am a big fan of exosomes. You have to be buyer beware, because a lot of people are just slapping the word exosome on things, and it doesn't necessarily mean, you just have to be careful, like where are the exosomes from? Like you have to remember, these are human derived. Like this is not manufactured in a facility, right? Like these are, I think the really successful ones are from platelets from people. So you just have to be careful. But I'm a big fan of exosomes. I don't have any affiliate or financial association with the company Plated, but I think the work that they're doing and the science behind it is really strong. And looking at lots of cool stuff, not just using exosomes for the aesthetic arena, but actually using it. How can we kill cancer using exosomes, right? So really a lot of exciting, cool things coming out.
Great. It looks like you've got quite a simple routine, which is like accessible to a lot of people. And then obviously if you want to take it further, you can, which sort of makes it very affordable for a lot of people, which I think is important. Tell us about your morning routine.
Yeah. So morning routine, I'm sort of plus minus if you want to wash your face. So when I was younger, I had very oily skin and acne, and I had to wash my face. Now that I'm in my 40s, I just splash water. I don't even wash my face. So I let people kind of choose based on their skin and maybe time of year, right? If it's very humid, you may want to. So splash water on your face or gentle cleanser. I do think using an antioxidant serum is important. It pairs really nicely with your sunscreen. So this could be plain vitamin C. A lot of vitamin C serums also contain other antioxidants. Exosomes are considered antioxidants. There are other, just pure antioxidant serums that you can get. But I think putting that on and then doing either a moisturizer or just your sunscreen, really that's my morning routine. So it can be pretty simple as well. I really say sunscreen's non-negotiable. I know people will say, well, look at the UV index or what are your plans for the day? But I find if you do, you're going to forget if you do that. And it might be rainy in the morning and then it's sunny when you leave work. So I just think make it a habit, make it your moisturizer, just wear it every day. And then you don't have to worry about skipping or forgetting.
Are you talking about your face specifically? Because obviously, I've been a user of, sunscreen on my face. Not on the rest, because I think we malilluminated with not enough red light. I think if you're behind windows, that's a concern because you cut off the red light, the infrared, and you just expose yourself to UV, which is an issue. So are you talking specifically about your face that you should be putting on the sunscreen, but the rest of your body without burning? And then we'll talk about burning and sort of the dangers of burning. But do you have a view as a dermatologist how important sunlight is with regards to the penetration of it without sunscreen?
So I am mostly talking about face. I will say if it's summer or it's hot, and you're wearing shorts and you're going to be outside all day, then I would recommend putting it on the areas that are exposed. For me, because I go to work and I wash my hands, up to my elbows, I don't put it on the rest of my body. So I am just putting it on my face. But for men, if you're balding or have a shaved head and, back of your neck, ears, you're going to want to put it on there. And I don't think I followed your question, the second part of your question.
Yeah, look, I think it's important, but just the lack of sunlight as a dermatologist, and this is sort of something that is very, very important. Of course, the UV on its own can cause significant damage, but the sunlight has got red light and infrared in. And so as long as we don't burn, I think the burning is something that is crucially important to understand if you burn. The question is, obviously, the UV on your face is going to age you, even if you get in the red light. So if someone doesn't want to age, of course, just getting sunlight on the face is going to age, and maybe you can speak into that. But the rest of your body is in need of sunlight for many, many reasons, especially if you have an SPF, it cuts your vitamin D absorption. So maybe as a dermatologist, give us your view on ensuring, that people get sunlight without burning, which is a message that I get out to our community.
Yeah. So it's tricky because if you have skin like me, I really cannot tolerate any sun. Like I will burn super easily. My husband has darker skin. He can handle it a lot better, and my children as well. So I do agree. I'm not one of those people that's covered head to toe. I mean, you've got to live your life. I do find even if you wear sunscreen every day, we're not putting it on as thickly as we should. We don't reapply. We're sitting by windows and we're still getting UVA through the windows. But certainly if you are really fair skinned, you're going to be more you really can't you can tolerate very minimal sunlight versus someone with darker skin. But I agree, try not to get tan. Certainly try not to get burned. Is sunlight important? Of course it is, right? I mean, it's essential to life. But what is harmful is when you get too much and you burn, and even tanning. Like I think people think, oh, tanning is good, but tanning is a sign of your cells trying to protect the nucleus, your DNA, and with enough exposure, that's going to prematurely age your skin. You may not get skin cancers, but you're going to get that premature aging. So it's tricky. And I think you have to kind of know your skin type and what your skin can handle and what it can't handle. What I like to do, I put it on once in the day, and then if I'm out taking a walk with my husband or whatever later in the day, it's 5 o'clock, I'm not too worried about that. So I would say just try to avoid like the peak intense sun, which tends to be between 10 and 2. Try not to actively get burned. And just make smart choices. Like instead of sitting in, if you're out lunch or something, don't sit in the table in the direct sun, maybe sit in the shade. And I do find, at least where I live, we do have a lot of sun. that people are getting more sun than they realize. The
Mm,
other thing you mentioned about vitamin D, I mean, vitamin D is super important, very important for our immune function. Most people are deficient, and interestingly, or I shouldn't say most people, it depends where you live, but people who have darker skin tend to be more deficient than people who have lighter skin, which I think sometimes people think it's the opposite. And then depending on where you live. So I would say get your levels checked. And then a safe way is to supplement with vitamin
mm,
D. So I recommend doing that as well. But studies have actually shown just looking at people who wear sunscreen versus not, that didn't really correlate with vitamin D levels. So I think it's more
mm.
kind of our work life, being inside a lot. If you live somewhere northern, high altitude or whatever, and you're not getting a lot of sun, wintertime or days are short, so I would say the simplest is just to supplement with vitamin
Mm.
D.
Because we've done a lot of testing over the last 18 years, and there's almost no one in sunny South Africa here that has got correct vitamin D levels. And it became a huge
That
thing.
has what?
Normal or optimal, should I say, rather, vitamin D levels. So the
Yeah.
question begs is, should we get out into the sun, make sure we don't burn to get the vitamin D levels up, which is very, very important. Of course, supplementation. But it would seem that you're right, that the people with the pale skin who get a lot of sun without burning and even put sunscreen on, their vitamin D levels are higher, which is obviously they're trapping the sun quickly and getting the conversion. But there were studies also out of Queensland and meta-analyses showing that indoor workers get as much melanoma as outdoor workers because of they're outside, they're acclimatizing to the sun without burning. Sort of, what are your views there? Because I think very, very important is melanoma and people being aware of that.
Yeah, so I'm not familiar with that study off the top of my head, but
Mm,
melanoma is tricky because sun is a risk factor for melanoma, but it's not the only risk factor.
mm,
There are a lot of genetic factors. Like, why are we seeing melanoma in really young women, right? Like that tends to be a different kind of
mm,
melanoma than the melanoma a 70-year-old man gets who's worked outside on his back. So there are also different subtypes of melanoma. And we know that some, like lentigo maligna melanoma, are very sun derived, very sun induced. But the most common melanoma, which is a superficial spreading melanoma, that one does not seem to be, well, I don't want to say it's not sun related, but it's got other factors at play as well, including genetics and things we don't fully understand. So
mm,
melanoma is tricky because sun is just one component of it. We do know that blistering sunburns before the age of 18 do increase your chance of melanoma, but there are other factors too
mm.
that we've yet to figure out.
So your message out there, Dr. Mina, because it's very important, is don't burn, number one. Number two, the sun is going to age you, not necessarily cause disease. So your face,
Right.
from an aesthetic perspective, so make sure you use sunscreen. Would that be your message out there?
Yeah, absolutely. Mm-hmm.
Brilliant. Okay. So let's talk about the perimenopausal, menopausal women. And even in men, we've seen major changes with regards to testosterone over the last 30 years. I just every single day here in the clinic, it's someone saying they've got low testosterone, and we've seen estrogen increase in men significantly, which has been a concern. But let's talk about just the holistic factors before we get into the nitty-gritty of all your treatments that you do. Is what should be people doing for their diet with regards to this, the time in the life, that they've got perimenopausal, menopausal, even your archetype, your male archetype that comes in under pressure, in a corporate executive, a business leader who's got low testosterone and maybe hormonal imbalance. From a dietary perspective, let's get your wisdom there.
Yeah, gosh, diet is huge. And I actually was a vegetarian slash pescatarian for almost 30 years. And I just 2 years ago stopped because I was craving protein. I really needed protein. So diet, at least in the U.S., it's the SAD diet, the standard American diet, and it's a lot of processed food. It's not whole foods. It's not fresh fruits and veggies. It's prepackaged. So diet is huge. Like we're eating a lot of empty calories, a lot of processed food, refined sugars, and that's going to affect our skin. That's affecting our inflammation in the body, our gut health. So I really love the Mediterranean diet with a focus on lean protein. That's something that in midlife, women especially, but really everyone, probably could use more of, like bumping up your protein intake, and then focusing on eating food that looks like what it is, right? Like if you're going to eat, don't eat a carrot flavored something, right? Like eat the carrot, eat the broccoli and salad, and fiber, right? Like that's a big one too, looking at fiber. So I would say the first thing I would tell someone is to maybe keep it a food diary, journal how much protein they're eating. Are they getting protein at every meal? And then another big one is how much sugar. This is really astounding. I would have said, oh, I don't eat that much sugar. I don't eat desserts all the time. I'm not snacking on junk food. But there's sugar in, like your marinara sauce. You wouldn't even think of having sugar. So it's pretty astounding. And really, we should aim to have about 25 grams or less a day. And that might be in one Starbucks drink, which is just crazy. So I think, especially for skin health, I would say focus on how much protein you're eating, focus or take a look at how much sugar you're eating, like refined sugar, and then try to eat what we say, eat the rainbow. Like when you look at your plate at each meal, is it colorful or is it all beige, right? You want to eat things that are red and purple and blue and green and, all sorts of colors. I think that is a great way to really get all the nutrients and antioxidants that you need.
Brilliant, brilliant. So nutrient dense diet, lots of color in the plate, lots of fiber, and less sugar. Your view on EPA and DHA, these essential fatty acids that we find in sort of these omega-3, supplements plus oily fish, is that important for the skin?
Oh yeah. So definitely, things like salmon, omega-3s, this can be very helpful for your skin as well. So if you're not eating a lot of foods rich in that, then considering supplementing would be important.
Brilliant. Exercise in terms of sweating, one of the things that has benefited my clientele and the patients here is for people to get sweating, and especially on the face. A lot of people put on products, and then I love your simple approach because I think you're not trapping and clogging the spores. So like you go to the gym sometimes, and then you see these people, they got this makeup on and all this stuff, and there's no sweating happening. How important is it for the face and the skin to sweat?
Well, it's funny. I think a lot of women can relate to this. I have to plan my workout schedule around my hair washing schedule. So there are definitely times where I'm like, I don't want to sweat just because I know I'm gonna have to do the whole routine. But yeah, really, I want people to have amazing, gorgeous skin that you don't have to wear makeup, right? You could you don't need to put anything on your skin. I think the less is more, but yes, like moving your body, getting your heart rate up, sweating, all of that is super important for heart health, skin health, oxygenation of your tissue, your skin. So yes, of course, that's super important. And I also recommend for sort of my midlife people to focus on resistance training. I think a lot of women resist doing that. They think they're going to get bulky. I'm guilty of this as well. And so we've been focusing so much on cardio for so much of our life. And now we need to also realize lifting weights is important too. And I know when I'm doing more resistance training, I don't sweat so much, but I have to remind myself, like, I'm still working out. I'm just doing it in a different way.
Okay. But if your face is not sweating, but the rest of you is sweating, you get a lot of toxins that are released through sweating. It's one of the important ways. If your face is trapping that release, that's going to be a problem. As a dermatologist, we want your view there.
Here's the interesting thing. we have so many sweat glands. So I'm not concerned that your face is not going to sweat. People get Botox in like their armpits to prevent what we call hyperhidrosis. So they don't have excessive sweating there. Sometimes people will get it in their scalp so they don't have excessive sweating. So we have, just so many sweat glands. So I'm not too worried about that, that you're going to still be sweating a little bit.
Talking about the skin microbiome and, the overuse of sanitizers and destroying these very important bacteria as a skin barrier. Talk us through your protocol to ensure that people maintain a good, healthy microbiome.
Yeah, so important. We saw during COVID, right? Everyone was over hand sanitize. I don't want to say over sanitizing, right? But like we were so worried, right? We were washing our hands. We were putting hand sanitizer. People are sanitizing everything. And I was seeing a lot of issues with the skin because we were, like stripping our skin of the healthy bacteria. And I think it's important for people to realize there's a balance in the world between good bacteria and bad bacteria. And we've got good and bad bacteria on our face and our gut, all over. And so when it's not in balance, then you get rid of all the good bacteria, right? Then all the bad stuff flourishes and can worsen inflammatory skin conditions. So this is why, overly stripping your skin of, with alcohol, witch hazel, very harsh products is not helpful to the skin, and it disrupts our normal, homeostasis and balance. So I think it's important not to strip your skin of those. You don't need to be using antibacterial cleansers on your face and your hands all the time. There may be times it's recommended, but in general, you don't need to be doing that. And I think we will in the future see more of an emphasis on certain skincare products that maybe have probiotics, prebiotics, postbiotics that can help restore that balance. But for now, what I would say is the best thing you can do is, again, your diet and getting your gut microbiome healthy, and your skin microbiome will also be reflective of that.
Having a lot of experience with perimenopausal, menopausal women, is there a specific protocol or is there specific insights that you'd want to give them specifically? Because looking at your Instagram, someone wakes up in their 40s with a big zit or an oily skin and their face melts at night, like you said. Is there sort of something that they need to know and do?
Yeah. So a lot of times I feel like women, they don't even necessarily know they're in perimenopause, but they see their skin changing first. And that's sort of the first, then they come see me or their dermatologist, like, what's going on with my skin? I'm breaking out. I never broke out before. I'm seeing this crepiness I've never noticed, or my skin is really sensitive. I never had to worry about, this product and now I can't use it. So first of all, I would just say you're not going crazy, and it is normal. It is natural. During perimenopause, your estrogen levels are fluctuating. Some months they might be really high, some they're really low. And while they're fluctuating, it's also making your relative testosterone levels seem either elevated or depressed. And so that's why we see things like acne, a lot of hair loss. Women are like, and this was me. I've always had thick hair. And all of a sudden I'm like, am I seeing more of my scalp than ever before? And it's all due to our hormones. They're so powerful. So this is a natural, normal part of aging. So I don't want people to think, like this is, anything abnormal, but there are things we can do to help it along and to maybe help some of the side effects that aren't so desirable. So things that we can do to help with the hair loss, to help with acne. And that might involve getting on hormone replacement therapy as well.
Okay. Brilliant. And to the male that's struggling with hormones or low testosterone, often, my male clients and patients, they've got a very dry skin, really, really, and they just say to me, I can't, it's just everything's so dry. Anything specific there?
Yeah. So I would say moisturizing. I find a lot of men don't moisturize and a lot of people don't, but it seems like especially men, they don't like the feeling of stuff on their skin, and maybe they try one product and it's really oily and thick and they don't like that. I love certain hyaluronic acid products. I find that they can absorb really nicely. The trick is to put it on when your skin is slightly damp, which maybe seems counterintuitive, but when your skin is a little bit damp, put on your moisturizer and it will help lock it in, versus when you do it on your skin that's totally dry, it has a tendency just to kind of sit on the top and not to penetrate inward. But I would say just make sure you're not, I think men too, also some of the male products out there, they tend to be a little harsher and a little more drying of the skin. And so just making sure you're not using an overly drying face wash. Aftershave that can be really drying for men, and stick to more moisturizing products, things with hyaluronic acid, ceramides, those can be really nice.
It seems like to trust, because I'm going to get into sort of topical products and supplements, that you should rather go to a physician, because then they know exactly what is in there. It's not too complicated. It's not often based only on profit, and you seeing the patient.
Yeah.
Do you think that's important, that physicians like yourself, dermatologists, would have their own range?
Oh my gosh. Yeah. I think, unfortunately, we're in sort of this like climate of a lot of distrust towards the medical community and physicians. But, physicians have gone to medical school. They truly understand how the human body works. And we understand when things need medication and when things need more holistic, like diet, exercise, supplements, right? At least in the US, it's hard as physicians who take insurance to have the time to really go over all this with patients in our limited, 5 to 10 minute slot that we get with patients. But I do see this sort of push where physicians are saying, this isn't how I want to take care of my patients, and sort of electing to either not go through insurance where they can have more time with their patients. But 100%, I feel like, if you really want optimal health, a physician, a medical doctor is going to be your best bet. I mean, we're the only ones who took a Hippocratic oath too, that to put patients before profit and, to do no harm. Right. So unfortunately, I feel like the pendulum has kind of swung to sort of like these wellness influencers are the only ones who care about holistic health. And I would like to see that shift move back because I don't know any physician who's not who doesn't care about getting to the root cause and really wanting to help patients. It's just a tricky climate to do it. But yeah, I totally agree with you.
Okay, so then let's talk about your treatments. I've done a lot of PRP, facial PRPs. It's been incredible. But take us through sort of the most affordable, because once again, what I like is, there's a lot of these expensive products all over, and people don't know if they work. They don't know if they're damaging what's inside of them. There's, in South Africa and Africa, obviously not so, and I don't know the details in the US, but you're just not sure sometimes in regulation what's happening.
Right.
What are really good treatments if someone comes to someone like yourself, from the lasers to the microneedling? Where would you take us on a step approach there?
Yeah. So I would say make sure you're doing all the at-home stuff, right? Like look at your diet. If you are, eating a ton of junk food, smoking, drinking a lot of alcohol, not exercising, you can spend thousands of dollars and you're not going to get the results you want. So the stuff we talked about previously, all of that should be ongoing. It really depends on your skin needs, right? Like my skin is going to need different things than someone else's. But in general, like say someone maybe in their 20s or 30s, I think just taking care of your whole body is important, managing your stress. But if you want to do a little microneedling, I think is a great way for someone with younger skin to get some collagen boosting. Maybe they've got some acne scars that need addressing. But I am a big fan of microneedling, especially for scars and a little bit younger skin. More mature skin, especially if there is some sun damage to undo or some like volume loss, then I love kind of ablative lasers, things like a CO2 laser, an erbium laser. These things are really powerful at kind of cleaning up the skin surface, making it look more vibrant, beautiful, healthy, and also collagen boosting. So I think that can be a great option. And I love things like biostimulants. So Sculptra, if you guys have that, Radiesse, like these are, I can actually inject where I want the collagen boost to happen, which I like. So usually we're doing it on the face. And that can be a great way. I say it's like putting, putting money into your savings account. You know, you're going to lose your collagen. So kind of supplementing it or giving it a little boost every now and then can be helpful with some of these biostimulants. But there are lots of cool things. There are like biostimulant masks out there now. There are these carboxy masks that basically form a hyperbaric oxygen chamber for whatever skin you put it on, like your face or your chest.
Wow.
So lots of cool things, depending on sort of your budget and how, how cutting edge you want to be. So lots of cool things, but yeah, I would say see a professional like a dermatologist who can really let you know, like the microneedling is really not going to touch your skin. You really need, this or that. But I am a fan of these energy-based devices that you can have done in the office.
Brilliant. Sounds incredible. And you do them in your office, Dr. Mina.
Yeah.
Brilliant. Okay, so moving on to anything else that you think from the surgery to the PRP or to the Botox or the fillers. I mean, where are you sitting with those things?
Yeah, so I think it's really just personal preference. I do find, I think people are a little scared of fillers now, which is because we've seen a ton of bad filler. So I usually have to encourage people that you don't notice the good filler. So there are just times where you have volume depletion and common areas. Your lips can lose volume. Your temples lose volume. For men, they sometimes don't have that strong jawline that is desired. And so this is where things like HA filler, hyaluronic acid fillers can be really helpful at restoring that volume loss. And it can be done by, skilled injectors without looking like a caricature cartoon. So I just want people to know, like, it can be done very naturally. Botox, like I know some people are some people like it, some people don't, but I do think it is when done well and placed well, you can still emote, you can still show emotions, you can still look normal, but it does soften, like especially here where people get those scowl lines. It can help prevent those lines from becoming deep and sort of etched into the skin. And so using it, using some units a couple times a year can be really impactful and helpful with that. So those I think are great. I think it's a great product to try because it's not reversible, but it's not forever. So it will wear off. So if you don't like it, you never have to get it again. But I do find people usually do like it. And it's also, I find in midlife, women are really focused on their necks, and it can be used to treat sort of this large muscle we have called our platysmal muscle, and can help with some of the pulling and the lines that we get as well. So I think, again, people sometimes get scared off by Botox and fillers because they've seen some like weird looking Botox and filler, but it can be done really safely and naturally.
Oh, yeah, the physician's key, isn't it? Because you're going to get good physicians and not so good physicians. And I think that's in any field, isn't it? So that's really, really important. Okay,
sorry to interrupt. I also just say, like, find someone who's willing to tell you no, right? Because if someone's always telling you yes, oh yeah, I'll do that, I don't think you're going to get the best results, because sometimes I have to say no, like, you don't need more of that. I'm not going to put in more filler. I'm not going to do this. So I would say, find someone who's not afraid to tell you no when they don't think it's going to look good.
Okay, brilliant. Supplementation, obviously looking at some quality supplements, possibly through a physician or, third party tested. What are your top supplements with regards to skin health, not only facial skin health, but just skin health?
Yeah. So skin health. So I'll start with what I take. I take a multivitamin, and I also supplement with vitamin what is it, D3K2. So I find that that's really helpful. My vitamin D level, I want to say, was 60. So it's pretty good. But I know that I am very careful in the sun just because I do burn. So I do vitamin D. I'm also doing a more like anti-aging supplement from Elm Biosciences, which has a lot of kind of like natural herbs and ingredients that have been shown to be helpful. Hair supplements can be great. Things like ashwagandha, saw palmetto, those can be helpful for hair loss. I know a lot of people do collagen powder. So I kind of go back and forth on that, whether I take it or not, but collagen powder can be helpful for collagen boosting. And then creatine, I know you probably see a lot of your patients with this, but that's something I'm like, I probably should start taking that.
Yeah.
I'm the right age too, but just to help with muscle as well, right? Like your skin always looks better when you've got strong muscles under it.
Yeah, brilliant. You should have Professor Kandau on the podcast. He studied creatine he was on the podcast here. It would be a brilliant show.
Amazing.
Because I think you could speak into skin health once again. And I think that's sort of your mojo. Okay, brilliant. Biohacking tools like these LEDs and infrared and cold plunges and saunas. And what are your favorites there? Even hyperbaric. It's so interesting you said that. I'd love to find out more about that hyperbaric, but what hyperbaric oxygen therapy would do to skin health, and especially the skin on your face.
Yeah. So it basically has like a rush of oxygen to the skin. And so that can just kind of give you a glow, it makes your skin look brighter, healthier. I also was using it on a gentleman who had a really slow healing wound on his leg. He did not want to go to a wound clinic. He only wanted to come see me. And so I've been putting that on his wound to help speed up healing. So essentially it's like a little mini hyperbaric oxygen chamber. And then interesting, people have used it when there's filler occlusion. So when filler, it's a known risk with filler that it can get into an artery. And when it gets into an artery, it actually blocks the blood flow and it's an emergency. And so people have also been applying it if there's an occlusion to help increase the oxygen to the area. So I think that's really cool. LED, all the rage. I think you just need to buyer beware. Like, the in-office ones are going to be stronger. You have to be consistent. Just make sure you're getting a good product, not just like a light bulb that's painted red. You really want that red wavelength. Saunas are great. I mean, I think all of these are helpful too, not just with what they do actually to the skin, but sort of the relaxation or the meditation and sort of the ritual that comes with doing that as well, that you've got 10 minutes, you're going to sit under your red light and maybe meditate or pray or reflect, right? Like, I think, again, that's like super helpful for mindset, which again is all linked to skin health too. I'm really into platelet derived growth factors as well, which are kind of like the next, like one step beyond PRP. So instead of relying on someone's own plasma, it's sort of pooled plasma from people, tend to be younger people, and I find that can help speed up healing after doing ablative lasers, things like that. People are looking at it for hair regrowth as well. So wow. I think it's a really cool time to be in medicine, to be alive, because so many neat, so many cool things are coming out, regenerative therapies.
Cool. Last message of hope or anything that we haven't discussed that you think is important for people's skin health?
Yeah, I would say if you really want to invest in your skin health, I would say see an expert, see a dermatologist. Like, don't just count on marketers or people trying to sell you something, right? Like, see an expert. And I know, at least in the US, it can sometimes be hard, which is why I have a podcast to try to give people information that they maybe wouldn't be able to get. But I just find a lot of people are taking advice and from, the internet or from questionable sources. And then, at best, they're wasting their time and money, but there actually can be harm to your skin. And so I would just encourage someone to see your skin as like a true organ of your body, and and to see someone with like true expertise in the skin for your best results.
Brilliant. Well, I want to declare favor and blessing over you, Dr. Mina, the work that you're doing. I love the simplicity, and I also love the focus on, perimenopausal and menopausal women. And we'll put all the links to your website. Is there anywhere specific you'd like people to land?
Sure. Yeah, the skinreel.com is my website, podcast. You can get it wherever you listen, also YouTube channel. And then if you are midlife and you want my sort of little free PDF guide to perimenopause, you can go to theskinreel.com/Peri, PERI to grab that.